Hello, my name is Emma Woodeman, and I was at Belton Hospital this past Saturday for my 13-hour shift. I was on the med surgical unit, and my clinical nurse manager was Annette and Mary. They're not actually managers, they're nurse leaders, but Ashley Sage, which is my person I follow around, told me to put their names. Anyway, so for assess unit organization. So again, this is Med Surg Tele, and I realized what Tele meant. I didn't know that until halfway through my shift. Tele means that there is, I even spelled it wrong. I really had no idea what Tele meant. It means that every single patient that comes through gets this little thing. It's like a battery thing, like that big, and it goes here, 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 and here. And my nurse taught me you put the fire red's down here, the black smoke's up here, the clear one is up here for the clouds, and then the grass is down here, and then brown is just a random color that no one likes, and so it's in the middle right here. And so she said that her preceptor taught her that, and she taught to me, and now I actually remember. And so all their heart monitors and their sinus rhythms and AFib, all that jazz, it's hooked up to the screen, and then there's people that they hire to look at the screens. And so that way the nurse is the first person who knows if anything weird's going on. So they do their job to just stare at these screens, and it's really cool, and that's why it's called Tele. So yeah, and then the unit staffing pattern is 5 RNs, there's 0 LPNs, and there's 1 PCT. And so the ratio is 1:4. Number of beds are 22, and there is a typical 20 for the daily census. So the top 5 health problems, medical diagnosis, surgeries, all that jazz. Congestive heart failure, number 1, CODP, urinary tract infections, diabetes, which is uncontrolled diabetes, and then the 5th one is alcohol withdrawal. And I just asked a couple of nurses, and they all agreed to that. So then diagnosis. So some nursing common diagnoses is risk for injury, risk for falls, fluid imbalance, and then ineffective airway clearance. So for implementation, review second motor skills frequently performed. So it would be using walkers, SCDs, non-slip socks, IVs, and NIH scales, strokes. Then for the 5th question, access the electronic pharmacology. I can't read. Resources of the most common medications. So hopefully I can say these all. Metoprolol, hydrocodone, Zolfran, potassium, and Zosyn. So metoprolol is for heart, hydrocodone's for pain, Zofran is for anti-nausea. Almost all my patients have that one. And then potassium, half of them have that one. And then Zosyn is for bacterial infections. And then lastly, access patient electronic health records. Yes, and it's through Meditech. Yeah, learned a lot. So my goals. So I realized that I walked in there very nauseous and scared, except before I walked in there, like the day before, I was like, I'm gonna do this. I was like bragging to everyone. I was super excited. And so I walked in there and I realized I don't know as much as I thought I did. And I liked what my nurse, Ashley, said to me. You need to make sure you're observing, because when you go in, she goes, even has a nurse, she's been a nurse for I think almost a year, she said, something like that. When you go in, you have to view it as an open glass, and this is your glass, and it's open, and it's not full. And so all you want to do is have that glass be filled when you leave. And so if I go in there with an open mindset of I just want to learn and fill my glass, then every single shift I go in, I'm learning something new and I'm growing in my experience. And so she did something new for like the very first time in her nursing practice. And we had this patient who had a type of surgery, prostate bladder something, and so he had cancer, and so they had to have surgery to take the tumor out, and he had all these little what are they called? He had a lot of blockage because of the, oh my lordy, I'm forgetting. I'm in a video. Clotting, thank you. Clotting. A lot of clotting, and so because of the clotting, he couldn't get all, we had him on all the, sodium chloride, and it was like these giant packs like this big, literally this big, and we had him on 2. We had to like fill his, or change them out like 12 times, or he went through 12 bags. We had to change them out every hour, and it was just going through him to clean out everything. And so these clots that were getting drained out would get in his what's it called, in his catheter. It stuck, and so we'd have to go in and flush him. We learned that on Friday. We have to flush it and flush again and again to get the clots to come out, and they would just come out, and it was but it would make his body go into spasms because of all this fluid that was in his bladder that wasn't getting out, and the pressure, and so his body would go into spasms, and he knew every single time one was that it was stuck because of the spasms. And so he would call us, we would come in, he'd be on this pain, and it was just so sad to see. And so I learned something, and then she learned something, and it was really cool to be able to understand. She explained to me the science behind it, the anatomy behind it, and it was just really cool to be learning about that. And it was her first time too. So the second goal is to ask to do things. I was so annoyed at myself because I saw her do something like 3 times, and then it was like she had to do it, you know, the 4th, the 5th, the 6th, the 7th time, and she kept on doing it, and I was like, I could be doing this because I've seen her do it, I've learned about this, and I just have the confidence to do it myself and to ask her to do it on my own. And so I realized she probably forgot that it's like, oh, Emma's here and she can help me, and I should give some texts to her to do. But I felt confident at the end, and so I should have probably started asking to do things on my own. And then my third goal is to ask more questions. I realized that there's no stupid questions. I literally asked what pneumonia was, and I've learned that like how many times. And so, but when I was nervous and when I was stuck in the situation of, oh, my patient has pneumonia, what's pneumonia? And then I was like, oh, fluid in the lungs and like XYZ. And, you know, I was able to understand a lot more after I asked her, what's pneumonia? Because I'm forgetting. And when I started making the connections and actually seeing it and seeing her side effects and seeing how it's affecting her body, it was so cool. So I need to ask more questions. That way I can actually be a part of the process and knowing. And if patients were asking me questions, and so the more I know, the more I can actually answer them and not be stupid and be like, let me get your nurse. I'm not actually your nurse. So, yeah. So I'm at 8 minutes and 43 seconds. Awesome. So it was a really good day, and I'm really excited. And the staff there is like a freaking family. I'm doing a video for class. Sorry. That was my sister. So I realized everyone there is like a family, and they're very, it's a very small hospital. And so something that all the nurses were saying to me was that they're grateful that they work in a small hospital because it's so small. They create this bond, and they all like remember each other's birthdays and things, and so it creates I don't know, like a safety for the patients because they're all working together and helping each other, and they're not just focused on their patients, focused on themselves, like they said other hospitals are where they worked before. And so I'm just really grateful to be at this hospital, and I'm really excited for what I will learn. And yeah.